Hello, my name is Des Fernario, and this is my oral exam for Medical Terminology Fall 2025. Rhinorrhea. I like to use tissues with aloe to deal with my rhinorrhea. Hemostasis. I had to grab a Band-Aid after I cut myself to help with hemostasis. Retinopathy. Diabetics need to have yearly eye exams to test for retinopathy. Adenopathy. Steve was dealing with adenopathy, so he made an appointment with his primary care provider. Esotropia. Samantha was born with esotropia, therefore she was prescribed glasses to help correct it. Gastroplasia. Susan had been dealing with severe stomach pain and vomiting after eating for months, so she went to her gastroenterologist, where she was diagnosed with gastroplasia. Myelogenic. We learned that some cancers are myelogenic. Therefore, it reminds us how important bone marrow is for health. Myelogenic. Bradykinesia. After Bob's stroke, he noticed his bradykinesia made physical therapy feel like a chore. Gastroenteritis. I thought I had food poisoning, but after 2 days, I went to the urgent care and was diagnosed with gastroenteritis. Carcinogenesis. In order to figure out what initiates cancer and how to prevent it, researchers study carcinogenesis. Colopathy. Alice was dealing with chronic irregular bowel movements and stomach pain, so she went to a gastroenterologist and was diagnosed with colopathy. Pancreatectomy. Rob had to have a pancreatectomy to treat his pancreatic cancer. Pancreatectomy. Narcolepsy. Lacey couldn't figure out why she was suddenly falling asleep while in the middle of work, so she went for testing and was diagnosed with narcolepsy. Hypercholesterolemia. Jerry had his yearly blood work completed and it showed that his cholesterol levels were elevated, so he ended up being diagnosed with hypercholesterolemia. Brute, or French bruit. When using a stethoscope on the patient, Dr. O'Toole heard a weird noise, or brute, or bruit, meaning that the patient had blood that wasn't flowing properly. Anhidrosis. Kelly didn't sweat regardless of how intense her workout was and ended up being diagnosed with anhidrosis. Strabismus. The ophthalmologist noticed Jorge's eyes were misaligned during his exam, thus confirming he had strabismus. That's what I'm using. Strabismus. Positron emission tomography. After having a stroke, Stella's provider ordered a positron emission tomography to check her brain function. Positron emission tomography. Okay. Oliguria. During Charles' inpatient stay, he developed oliguria, so the urologist was consulted to monitor his kidney function. Dyspnea. Since having COVID, Kim noticed that she struggled to breathe after climbing the stairs. She mentioned this to her provider and he told her she was dealing with dyspnea. Cardiomegaly. Karen had a chest x-ray and it revealed she had a cardiomegaly, which required additional cardiac evaluation. Arteriostenosis. Paul's cardiologist explained to him that he has arteriostenosis and prescribed him new medication. Hemolysis. Renee's yearly lab work results showed she has hemolysis, which would explain her anemia. Bronchoscopy. Earl was having chronic breathing problems, so his provider ordered him to have a bronchoscopy to determine the cause. Sigmoidoscopy. Mike had a sigmoid scopy, so the gastroenterologist could look for any pulps. Pancreatoma. Elizabeth's imaging showed she had pancreatoma, therefore a biopsy will be completed. Gingiovectomy. Brandon has a history of gum disease, so the periodontist performed a gingiovectomy to improve his oral health. Gingiovectomy. Rectocele. After dealing with intense pelvic pressure and issues with bowel movements, Tasha was diagnosed with rectocele. Analgesia. To improve the birthing experience and minimize pain, proper analgesia is essential. Oh gosh, okay. Cerebrotomy. Joe underwent a cerebrotomy to relieve intracranial pressure. And that's it. Thank you.